Assalamu alaikum, everyone. I am back again with another episode of DOGANA podcast, and this is Dr. Aman Tawheed. And today's episode is one that truly embodies the spirit of service, compassion, and leadership in medicine. Our guest today needs no introduction. But he absolutely deserves one. He's the co-founder of Pakistan Stroke Initiative. Most of you have heard about it. He's a visionary who turned the dream of awareness, prevention, and treatment for pathways of stroke in Pakistan into a nationwide reality. He's a neurologist by profession, and he completed his residency at Cleveland Clinic and fellowship at University of Pittsburgh. Currently, he is a professor of vascular and interventional neurology at University of Toledo, as well as the fellowship director there. So please join me in welcoming Dr. Fazal Zaidi to the show. Welcome, Doctor.
Thank you so much, Dr. Ayman. It's an honor, obviously, absolute pleasure. You're doing amazing things yourself, and I've watched your previous podcasts, and they're absolutely amazing. So thank you for what you're doing.
Thank you for joining us. It's such an honor for us. So let's dive in. Let's start. So I'm gonna start with a little bit nostalgia, थोड़ी सी DAO की बातें करेंगे, and then we're gonna jump into your initiative. So let's just talk about your DAO days and how did you choose the specialty which you are doing right now?
Thank you for that. Nowadays, it's a bit of a blur at this stage, right? It's so far out. I graduated in 2001. So our session was in 1996, 2001. So we're just coming around at our 25th anniversary now at this stage, and it's quite interesting as to how the time passed, really. But going back to the DAO days, I recall मैं recently hospital गया तो or college गया तो it has changed a lot. But there used to be a basketball court there, and I spent like countless hours. Like most of my time over those 5 years were spent either there or hanging out with my friends, like most of us. So that's what sticks at this stage right now.
Got it.
Yeah.
And the other part of my question was, how did you choose the specialty?
All right. Yeah. So specialty, I remember distinctly. I was in my clinical rotations. I think medicine की rotation थी, and walking to the outpatient clinics, there was this sign there saying Department of Neurology and Neurosurgery. Again in the outpatient part of the hospital. And I walked in, मैंने कहा पता नहीं अंदर यहाँ क्या हो रहा है, neurology, neurosurgery. I'm a third year medical student at this stage. And I walked in, वहाँ पे Dr. Shabir साहब होते थे, वो बैठे हुए थे. Dr. Server, who is now actually a professor at Aga Khan University. Great guy. So anyways, they were there and they were very kind to me. They're like, क्या कर रहे हो? अच्छा आओ उधर बैठो, हमारे साथ बैठो. And then they started just started teaching me basically. Patients would come, they would examine the patient, would ask questions to me. And that's what piqued my interest.
Wonderful. So let's move to the next stage. When you moved to the US, your journey from DAO to the US has been inspiring, especially for many aspiring students who are listening to you right now.
Mm-hmm.
Can you walk us through that transition? What were the biggest challenges moving from Pakistan to the US medical system?
Yeah, so see, every era has their challenges, right? Like we hear so much these days about, say, U.S. immigration policies, or to say as to what's happening with residency programs and how difficult it is to find one spot or even an interview right now. And quite a few students from DAO, from Pakistan, they reach out to me fairly frequently asking the same. And my point is, don't be disheartened. Every era has their own challenges, right? So when I graduated, our class, we graduated in August 2001. And then right after that, 9/11 happened, right? Within 2 weeks of us graduating, अभी हम लोगों ने USMLE का course खरीद कर लेकर आए थे कि ये पढ़ना है. And all of a sudden now there were towers going down. Embassies were in Pakistan were shutting down. इंटरव्यू वीजा के थे वो सारे कैंसिल हो गए. स्पेशल रजिस्ट्रेशन और पता नहीं क्या क्या प्रोसेस शुरू हो गए थे यूएस के अंदर. People were not getting dates for their interviews. Like you would apply for a date and you would get it in 3 months or 6 months, only to learn get reject ho gaya. So like there were horror stories all around you, and it can dishearten you right away, right? I mean, if you think about it, kare bhi nahi kare. But I think once you focus, once you decide you have to do something, you want to do something, no power in the world can stop you. I truly believe that. So make an aim, have a plan, and just go for it. You will get there. I firmly believe that.
Yeah. Okay, wonderful advice. So let's now shift to the heart of the conversation, Pakistan Stroke Initiative. It is an incredible platform that you founded and is bringing real change for awareness and prevention, as well as the treatment of stroke, especially in Pakistan, जहाँ पे इतनी सहूलियात मौजूद नहीं है. So let's begin with the story. What has inspired you to create or co-found this initiative?
Yeah, no, thank you for that question. So stroke, as we are all medical professionals, so fairly understand fully well that it's a devastating disease. Patients who have a stroke, if they don't get the right care at the right time, they can be left with permanent disability, may die even, right? Um, Medical emergency. Unfortunately, in Pakistan, even in our major cities, let alone rural areas, right? And even for people who can afford, seemingly, the choices for stroke care are very limited. I have a lot of family in Pakistan, and that used to be one of my concerns. कि खुदा न खासा people I know and care for and love, उनको stroke हो गया तो क्या होगा? See, stroke care in US, if you look at it, it's at the hospital level, it's divided into, say, stroke ready hospital and primary stroke centers, then thrombectomy capable centers, and finally at the apex are the comprehensive stroke centers. Comprehensive stroke center implies, in terms of joint commission definition, is a center where all kind of strokes, regardless of the age and gender and financial resources, they would get the definite care 24/7, right? Especially look at the public sector hospitals. Perhaps except for maybe the General Hospital in Lahore or PINS in Lahore, none of our major cities have a comprehensive stroke center, right? They would none of the centers would qualify or fulfill that definition, right? So बेचारे stroke के patients उनका क्या होगा और क्या हो रहा है इस वक्त, right? Um, Another thing, if you think about it, Karachi, for instance, right? I mean, I grew up in Karachi. Karachi's population, I don't think anyone knows Karachi की exact population क्या है, but we think it 2 crore है, ऐसे ज़्यादा है, right? So 20 million people or more live in Karachi. अब मैं रहता हूँ Toledo, Ohio में with a population of less than 1 million people. We have 2 stroke centers, 1 thrombectomy capable center. We have 3 primary stroke centers. Where you live in Virginia area, you probably have 10 comprehensive stroke centers around you. Karachi, ideally, just based on population alone, should have 20 stroke centers, comprehensive stroke centers. We have 0 right now. In public sector hospitals, there is none. So Pakistan Stroke Initiative was created to help void that gap. What we are doing, and again, I mean, there's a whole team of people, both in US as well as in Pakistan. And we have supporters coming from all disciplines, all walks of life, and in all disciplines of medicine. So from my dear friends who are in internal medicine to general neurology to whatnot, you right? Similarly, I have a friend who's a neurosurgeon who is integral part of the project. We have interventional radiologists who are in Pakistan who are again very important part of the project. So what we are doing right now is joining hands with Jinnah Postgraduate Medical Center, JPMC, which is again a very large, massive hospital, 2,200 bed hospital in the heart of Karachi, and working with Patient Aid Foundation, which is very entrenched within the hospital system there. We are creating a stroke center. Inshallah, our plan, if everything falls in place, is to start the stroke center there in July 2026. This will be an academic center. We will be offering formal interventional stroke neurology fellowship there, along with vascular neurology fellowship. So we're in the process of recruiting fellows. Plan is to a certain degree, I'll take a sabbatical from my job in US. Thankfully, I have the luxury to do so. Go to Karachi, start the program, get it going, and then our team, physicians, with similar background training like myself, will be joining me in this similar endeavor and get it done. So that's the plan in the nutshell. I know I talked so much about it right now. So
Yeah, no, wonderful. the the topic is so close to my heart. My mom is a stroke survivor. तो अगर वो यूएस में ना होती, so I can imagine if she was in Pakistan, I don't know if I would be able to see my mom. So this is a wonderful work you are doing, and may Allah make this successful.
No, thank you so much. And just like you said, stroke is so common as well, right? It's almost as common as coronary artery disease.
Mhm.
It's a number one cause of adult disability in Pakistan. A lot of times we are seeing stroke, unfortunately, happening in younger people there. It's not uncommon to see or get calls from people in Pakistan who are in their 30s, early 40s, having massive, devastating strokes. So it's actually, you cringe when you hear those stories. Kya hoga us family ka?
True. And TIA has also become very common for some reason in young individuals.
Yeah. No, what I'm realizing, because I go to Pakistan quite frequently as part of this work, is at least in our major cities, because of lack of primary care services there, like a lot of people have undiagnosed hypertension, and then the stresses in that city are very significant. I think environmental factors are playing a role as well. If you go to any of Pakistan's major city right now, I don't know how it was when you were growing up. Like, we could actually see the sky. You could see the stars and the moonlight and everything. You don't see that anymore.
You don't.
Uh, it's actually kind of scary, the environmental disaster we have created over the years there. तो उस हवा में रहना, जीना, blood pressure के मसले, smoking is still very common. पान गुटखे खाना, like it is a healthcare nightmare, really.
Definitely it is. So let's move towards the future of it. Like, where do you see Pakistan Stroke Initiative heading over the next 5 years? Are there any upcoming, like you said, you are creating that center there with the JPMC. Other than that, are there any upcoming programs, collaboration, and goals that you're excited about? I know you have a little bit answered it already, but maybe other than that.
Yeah, no, absolutely. So, as I mentioned previously, one center certainly would not be enough, would not be sufficient. We will need multiple centers through Karachi, through Sindh, throughout Pakistan. And one of the major gaps is lack of trained professionals there. If you decide to do international fellowship in Pakistan right now in neurology, perhaps in Lahore there is one or two, but that's pretty much it. There are no training programs. So kahin se to shuru karna hai. And that's the idea with JPMC program, is to have an academic center there where we also lay down the infrastructure for research as well. So those are our initial goals. Have a training program from where there is a good crop of fellows and future interventionists coming through, who are also researchers, who are also academicians, and come up with a system which is sustainable. एक बहुत बड़ी एक बहुत बड़ी जिसे कहेंगे चैलेंज है हमारे लिए, और होता है थोड़ा सा एहसास महरूमी जिसे कहेंगे आप, होता है. See, you and I are in US. If you look at your class or I look at my class, most of the students who could leave left Pakistan. And that's what the concern is, that you go back there, you train people, and once they're trained, they're under no obligation to stay local, right? It's very common for our well-trained physicians to be poached by Middle East. आपने train किया किसी को बहरीन चलेगा, वो कहता है दुआ चलेगा, दुबई चलेगा, and you can't blame them, right? We all did the same thing. We are all economic migrants. So how do we prevent the brain drain of our very best? Well, that's something to be looked into. That'll be our goal, to make sure that people, well-trained people, stay local.
Okay, so आप इसकी viability कैसे देखते हैं? Sabbatical आप लेंगे, एक limited है, right? So how do you see it being viable in Pakistan? You know, Pakistan is famous for corruption and whatnot. Just talking about, like, what's the plan?
It has to be a team approach, right? I cannot be the only one who can take the onus of a project this big on myself. So I didn't take names yet, but behind myself I have Dr. Hisham Salahuddin. He is in California, who would be helping us. I have Dr. Akhil Pabani, who's at Emory University, who will be helping us. I have Dr. Ahsan Sattar, who's in New Jersey, who will be helping us. Dr. Sophia Janjua, she's in California, she'll be helping me. But then on top of it, Dr. Irfan Lutfi, he is in Karachi himself. He is an interventional radiologist. So goal is that between 4 or 5 of us, plus more, I mean, there's so many people who are extending their help to us every day, we will be able to make it viable. And the point really is, what's the alternate, right? If not us, who, right? And if not now, when? Like, अगर नहीं करेंगे तो क्या? आज से 10 साल बाद भी हम लोग यही बैठे बात नहीं कर रहे होंगे, कोई स्ट्रोक का कोई सेंटर नहीं. We got to start somewhere.
Okay, so how do you envision Pakistani diaspora, especially our alumni, Dawites, um, help you or in general work in improving stroke awareness and outcomes in Pakistan?
Yeah, it will be yeah, it will be so unfair of me if I do not acknowledge all the help that the Dawites have provided me so far. And I should not restrict to just Dawites, like alumni from everywhere. लेकिन जो बचपन के जिन्हें दोस्त बोलेंगे, right? And it's been so heartening. I would call them and I'm like, okay, listen, I'm trying to start this project, and the people have been so gracious, so kind, so loving. मुझे नहीं अंदाजा था कि मेरे इतने अच्छे दोस्त हैं इस project से पहले. And I'm so thankful to this project because it brought so many people, so many of us together and closer. Friends who have been extending help, not just monetary, hosting events in their cities, calling on my behalf, on behalf of PSI, to their friends and extending, groups and families to pitch in to help us in every sorts of ways, right? Like, and it's not just monetary. Finding resources कि यार किसी device company को call कर दिया कि वहाँ पे सामान की ज़रूरत होगी. Reached out to major manufacturers for other things that we need for this project कि इनकी ज़रूरत होगी. So in so many different ways and avenues and aspects, people are trying to chip in and help. I'm just overwhelmed, really.
Wonderful. Okay, last, I think you have kind of answered, but it's just what's an ideal national stroke system in Pakistan in your eyes, or what do you foresee?
Yeah, so I think expecting we will be able to create what we have in Western world is, but at least having some semblance of a stroke system where we have primary centers which can at least give the thrombolytics to patients who are presenting in the early time window, and have a mechanism of transfer. वहाँ पे एक जो चीज़ मैंने नोटिस की, स्पेशली कुछ छोटे प्राइवेट जो निजी हॉस्पिटल जिन्हें बोलेंगे, प्राइवेट हॉस्पिटल सिस्टम्स, वहाँ पे पेशेंट होल्ड करना थोड़ा कॉमन है. In the sense, the patient will come to you. You may or may not be able to give them thrombolytics. You certainly cannot perform thrombectomy. Yet you will keep that patient in your hospital for next 2-3 days, right? And that's just wholly unfair to the patient. So one thing we'll need to do once we start this center to reach out to all our partner hospitals in the city, कि अगर आपके पास ऐसा patient है who's a candidate for potential stroke treatment, send them to us. Don't hold them. So that's a cultural change that will require a lot of hard work. Things don't change overnight, especially things which have been entrenched in a healthcare system for a really long time. Yeah. Again, it will be a work in progress. Will be interesting challenges.
So last segment I have is the rapid fire questions, some DAO questions. Like, before I jump into that, I would love you to give some advice or some good nice words for the young Dawites who are pursuing this path, or who can, whatever you think is nice for them to know.
Yeah. One thing, don't compromise. Don't compromise on your dreams. I'm a living example of it. I was not the smartest in my class by any means. So always middle of the pack. Yet I wanted to do stroke. I wanted to do neurointervention. Despite all the challenges that were thrown at me, the fact that I really wanted it, and I was just determined that I'll figure a way out to get into it. It just shows that if you decide कि आपका dream क्या है, what you're trying to achieve, and you really focus on it, you will get it.
Okay, let's start with the rapid fire. So my first question is, you cannot think much, just answer whatever comes to your mind. What's the first thing that comes to your mind when you hear the word Dow Medical College?
Tuck shop.
Okay. Your favorite hangout spot on the campus? Was it canteen, library, or the anatomy?
Basketball court.
Basketball court. Okay.
Basketball court. I spent a lot of hours there.
Most unforgettable Dow memory. It can be good, it can be mischievous, whatever you can think of.
Okay. We used to have a picnic, actually. Like in the final years, you would start doing it. Myself and a good friend of mine, she is in Indianapolis. She would know if she's listening to this. हम लोग सब as a group जा रहे थे, and I think जो point जिसमें जा रहे थे, बाकी जो दोस्त वगैरह बैठे थे ना, उनका lunch का I don't know exactly क्या हुआ था, but we ate everyone else's lunch.
Everyone.
Everyone, like चार पांच और लोग थे, बेचारों का सारा lunch हम लोग खा चुके थे. So when we got there, we got yelled at a lot, but it was too late by then.
Okay. Who was your favorite professor at Dow?
Late Dr. Shoaib Tawheed. Yeah, was an amazing guy. He was such a good mentor. He was very kind, uh, very genuine. You could sense जब आप उनसे बात करते थे ना कि he actually cared for you.
Yeah.
I miss him a lot.
I think the good thing was he was friends with people his age and all the kids and everyone. So that was a very good thing about him. Teen, samosa or chai? What was the real doubt for you?
Between the two, I think samosa. I was not a chai person back then.
Okay. What's one lesson Dow taught you that stayed with you throughout your entire career?
Friends are important. Don't underestimate the power of good friendship. And it requires work. Nurture it. Don't give up on your friends. Be kind and be a good friend yourself.
Okay. Thank you so much, Dr. Fazal. This was so nice. I felt like, I'm talking to an old friend or just हम reconnect कर रहे हैं. It was such a pleasure speaking to you. And I wish you all the best for your initiative. And please let us know, my batch, if we can help in any way.
Thank you so much, Dr. Ayman. This is great work that you are doing. Like I said, being a professional and a mom and doing this for DAO and Dogana. So we appreciate you very much. And yes, we'll be in touch. Thank you.
Thank you. Bye.